Hi guys, so we are here again, A to Z Psychology with Obian Chidoze. So we are still on exposure therapies, behavior modification. So today we will talk about, having discussed systematic desensitization, we are talking about today flooding and implosive therapy. Yes, one of the exposure therapies. And you remember that I love to remind us that there is a need for therapeutic alliance when the client comes. In that therapeutic alliance, you guys discuss in the informed consent everything. There is no need for debriefing and deception here, right? If not, you may be sued. The client must know which are you using, what kind of technique are you going to use, what is expected to do, how does it work, and what is the goal at the end, right? Now, in flooding, the therapist will tell the client what is necessary. A little overview about flooding therapy is that flooding was designed by Thomas Stamf, and yes, Thomas Stamf, even implosive therapy also, yes. So Thomas Stamp in the 1950s also, you see his work in 1957, 67, yeah, but in the 1950s. So Thomas Stamp provided this type of exposure therapy that do not have to go through gradual process or a systematic method of using hierarchical construction, right? So we directly expose the client to the fear-evoking stimulus. Yes, we often use this one when there's no need for those gradual process. Even if there is need, the therapist and the client may decide, let's go in through this one, right? You know, when I was doing the overview, remember I talked about a child that was just forcefully rode in a car, yes, and at a point the child had to understand that there is no problem crying and there is no harm even being in this car. Come on, it's even fun, right? That is implosive, right? You know, if you wanted to do systematic, you would have said, imagine we are by the door, imagine we are holding the door, or you go in vivo. Now this is a car, are you seeing it? Okay, stay here, I'll go and touch it and I'll come back and I'll hold you, we'll touch it together and we'll come back, and you will go and touch it and come back, and we'll go and open it and come back. And please remember your muscle relaxation therapy. This is systematic desensitization. But in flooding, there's no need for those processes. What we do here is, as usual, we start with muscle relaxation training that can last up to 6 sessions. When the client have understood it, there's no need for the second stage, which is hierarchical construction. In this one, what we do is straight to desensitization proper. So if you are using imaginary, then you use the imaginary. For example, this example, we use snake. The client will imagine that the snake is on the table here, and please remember there is, you tell the client, please remember to practice your muscle relaxation. Are you ready? So okay, let's imagine, and then right, and okay, you can't help it, you can stop here, then let's try it again. Okay, calm down. You know what, you have tried today, good job. We'll continue next week or next therapeutic session, right? From there, you guys can move on till next time, right? And then you continue directly exposing the client to the situation, event, or stimulus of fear, right? Until the client comes to a place that he or she is now relaxed and no more anxiety is felt at any point, right? And that is it. Sobriety, as we use in substance use, has been achieved. Now, this is it. On the other side, implosive therapy. Implosive therapy uses exaggerated situations. If you are having a situation of fear of snake, implosive therapy will want to, if you want you to examine it, he wants you to imagine that there are 500 snakes here. Imagine, okay, most time if they use in vivo, for example, and you're having fear of spider, right? They will want to lock you in a room filled with thousands of spiders, right? Now, this could be termed like flooding, but in implosive therapy, there are exaggerated situations that are not possible in normal situation. Imagine when the therapist tells the client, imagine there are 500 or thousands of spiders on your body. Imagine you are in a room and all thousands of snakes are crawling around you. Please remember to practice muscle relaxation. Okay, psychologists often view this one as unethical these days, but you understand that the clients should know if this is what is tenable and this is what you are going to use, right? But oftentimes we prefer to use flooding. If you want to do that in intense exposure, we often use flooding to do that instead of going for implosive therapy. So that is how we do flooding as a technique of exposure. Yes. And using muscle relaxation therapy, and the next is desensitization proper. So that is the size of that. Now there is something here. Imagine in a situation where your imagining will not help. Can you imagine being in a war situation? No. Yes, you can. And then the whole bomb is bombing and you're trying to treat somebody with PTSD, right? What do you do in this situation? Imagine, imaginary is not possible, in vivo is not possible. Like, you can't go back to a war situation, or you can't start up a war or wait for the war to occur before you treat somebody with PTSD, right? What do you do, for example, in such situation? What of aerophobia? Okay, imagine you are in the car, in a plane now, and the plane is about to board. This systematic and wait, and okay, and you are seated and you have put your seat belt, and okay, now the plane, can you imagine it's taking off? Please remember to practice. No, right? Imagine the plane is now flying and it's meeting some gallops and the weather is changing. Come on, can you do flooding in that too? Just put the client in an aircraft that is boarding and it takes off. Flooding, like in vivo. In real setting, you want to use a client that can throw tantrum at any point on the safety of the risk, the safety of the onboard people. No, you see, it's not that attainable, and most times you want to subscribe to imaginary, it may not be that effective. What do? This is the moment we turn to technology. And that takes us to the third type of exposure therapy we're going to be talking about. We call it the virtual reality therapy. Thank you, and see you in the next video.